the Western Cape. We believe that through this plan, I already said that. The Western Cape Government multi-sectoral TB emergency response plan. Sorry, I'm trying to read faster. This plan is data-driven and iterative, which means that we will develop and strengthen it further as we implement it. It is further guided by the World Health Organization's health system building blocks and key levers. Our primary goal is to make our TB program stronger than ever through a back-to-basics approach. The acceleration of innovations and harnessing collective responsibility through united action to end TB. I'm reading what the document says, and when I look to you, then that is also where some of my own things comes in, but I'm also careful not to get too passionate, because otherwise then I will talk from a individual point of view, and also as a healthcare worker, but also as a community member being affected directly with this disease. So obviously I will have my input. Why was it no? So like for instance, actions to end TB. Myself wouldn't use those words, end TB. NTB. I will use the words reduce the spread. Putting things in place to reduce the spread. That is the terms that I will use. That is me personally, but I know even who wrote the documents will agree with me. When you look at the picture now, we can talk about, let's start reducing the spread first and see. I'm trying to say it in such a word that I'm not like stepping on anyone's toes. I'm not stepping on anyone's toes, but we have to be realistic. We have to be realistic. Sorry. Let me quickly resort this out. I'm almost done with the video. I'm so sorry. Let me still speak faster. I'm staying in a community that has the highest TB rate in our sub-district or substructure. We have the highest TB death rate in the substructure. And then when I look at what fuels it, and when I look at, yes, we do have the health facility, the local clinic, one clinic accommodating a population of, I think we are now standing at 70 plus thousand. One facility, one TB nurse, one staff nurse also working in the TB room to accommodate such a big population. That is why I'm using the terms, these activities that is being put in place is to reduce the spread. We are actively involved in the TB program. If there's a reduction, then we can start thinking of ending. But I know we can already think about that. But when we talk about it, to be realistic and speak about reducing the spread, because right now it's spreading like wildfire. So that is the spread that we must stop, reduce. We might get to that point of ending. But for now, I'm not saying anything around that. We are fighting to reduce TB now. In doing so, we have a clear 4-step program in action. Now, the action plan is raise awareness of TB and its harms to our society, which is already in place, but it can be more. There's no limit as to who and how many can go out there and just create awareness. What I'm doing right now is create awareness. If someone is handing you a pamphlet about TB and just talk to you, it's creating awareness. If you have a pamphlet, if you Google something now about TB and you talk to your family member and explain what it is that you're reading now on the Google, on the internet, you explain to your family, it's creating awareness. If you have in your church days where health days or wellness days, you invite someone to come and talk about TB, that's awareness. Because everyone in the church is the community out there that's coming to church. Get someone, give the health education, give pamphlets so people can take home, read, understand what they are reading. That is awareness. So you have your role at school. Bring in these topics. When new nurses are training in the varsity and training centers, make that part of the curriculum. That's awareness. We must stop people from dying of TB. Raise awareness. So there's the radio. You can go onto radio. If you have a slot there on radio, mention about TB. Refer people, tell people where's the resources, tell people what is TB and what must they do if they were in contact with someone that has TB. Give them that information. It's you raising awareness. Now this person maybe didn't know he can go to the clinic because he thought he must have symptoms first. No, you don't have to have symptoms. You do not wait for the symptoms. You go for your TB test. Once you are diagnosed, you have TB, you start with treatment. What is your role now that you are on treatment? You must stick to staying on treatment. You must take the full course of that treatment. Depending on what type of TB you had, that will also be a separate video because TB is a very broad. So you do get different types of TB. You will see this person's maybe pulse look different than yours. You will hear this one is 8 months. Why you 8 months on TB but that person says they are 6 months on TB. That one says no, but why are you 2 years on TB? So people don't know these things. That is why we must create awareness, and teach people, teach the communities, teach. And in the facilities, when you diagnose, when you start the client on treatment, you explain the counselors. You must explain to the client why this time frame, what type of TB, why this time frame, why you must take this why you have to complete this medication. You have to counsel your client regularly. Support, because it is a long time to be on medication. That person needs support. So continue to support that person. Awareness. Prevent new infections. Rapid diagnose TB. Prevent new infections, meaning if I now have TB and I'm not going to go sort myself out quickly, like in going to the clinic, get tested, get started on treatment. If I don't do that, or if I found out I have TB, but now I'm not taking my medication, guess what? How is that, where's that second one? How is it that you're going to prevent new infections? Because you yourself, one person, when I step into a taxi, and remember the taxis are full, the taxi drivers, they make that taxi full. So you will infect everyone in that taxi. So now if I'm not taking my medication, I will infect that whole taxi of 10 to 15 people. If I know I have TB and I'm not on my treatment, how then can I prevent the new infections. I go to school, I don't take my medication. What about my classmates? What about my teacher? What about my friends? When it's vulnerable posters, then you have a whole lot of other friends also that you play with before you go back to your class. What about them? Rapid diagnosed TB commence early initiation. I think I said that. Early initiation of treatment and adherence up to treatment completion. You have to get diagnosed early so you can start on treatment as soon as you've been diagnosed. You start on treatment, you keep on taking your medication. That is what adherence means until the time frame of your TB, of the time that you have to take your medication. Mobilize a whole government and whole of society approach to tackle TB. I think they mentioned that. The first step in the response plan is to raise awareness. Okay, let me see how many pages is left. I left. Okay, it's one page. But it seems like I'm saying or repeating the next thing, so I'm just going to run through it. It sounds similar to what I've already said. Why is it no? Sorry for that. The first step in the response plan is to raise awareness of TB as the leading cause of death in South Africa. We said that for more than a decade. Encouraging more people to know and see the signs in themselves and in others and to react accordingly. Again, not only just signs, but if I was exposed, doesn't matter if I don't have symptoms, I must go and test. We will do this through smart interventions, including a weekly dashboard. So the dashboard you will find also on the Western Cape government website now. When you go in there, I don't know if they update it regularly. I've been on there. Go to it regularly to see what's happening. It's going to give you stats like how many people, and it's breaking it down to your substructure. So you can zoom into your substructure, your environment, and see what is the TB situation in your closer to you. Why was it no? Let me put the cursor on here. Yeah, similar to our COVID-19 dashboard, the weekly dashboard will include TB diagnosis, TB deaths, treatment successes, treatment initiations, and TB preventative therapy. TPT, you will hear that word a lot. I will come to that. That is the action plan that I want to get to. But I need to give you this little background first. Yeah. TPT stands for TB preventive therapy or TB preventive therapy or treatment. Yeah, this will be supported by a fully fledged public communications campaign to promote testing and treatment. The campaign will include personal stories, including those of survivors, messaging on personal responsibility or for prevention and managing on collective responsibilities. I think here they're looking at when they say people's personal stories is now when you were diagnosed with TB, you've completed your TB treatment, so you get to then talk about what was your journey. How did you know you had TB? How did you find out? Or when you went to the facility, what was the support that you got from the facility? Was there any support in the community? What about stigma? Did you had any challenges with any stigma? Because stigma causes people not to go to the clinic. Stigma causes people not to complete the medication. Stigma causes a whole lot of where someone isolate themselves because they don't want to be seen, or they don't want people to hear. That way now they can't get access to resources because maybe they're shy, they don't know what people are going to say about this situation that they are in now. So so stigma on its own, it's also actually, I would say a video on its own, because we need to stamp out stigma, we need to get rid of, we need to teach all of communities. We need to teach or train each and every person, because I think once you know what is this about and that there is help, that anyone can get it, I think maybe then you're not going to give problems to someone that is, diagnosed or or you're not going to treat that person differently now once you understand what the disease is about. But most of the time I do think personally, if you don't know about something, then you will think and assume your own thing. You will believe the myths. You will easily believe myths. So we need to work together. We need to raise awareness. We need to stamp out the stigma. We need to, if we want everybody to, once you feel you need support, you need help, for you to be able to reach out and not be shy and not attending the health facility. I was like, no. This will be supported. I talked about the personal stories, and I included the survivors, people that survived, that completed their treatment successfully. Prevention. These efforts will be supported by a campaign to destigmatize, there's the word, destigmatize TB in our communities. So one of the organizations that I know and I had the privilege to work with was TB Proof. Please go to their Facebook page, go to their social media pages. Sorry, their handle is at TB Proof. One word, small letters name, at TB Proof. Go to the different social media platforms. That is their social media handle. They are fighting against stigmatized. They are involved in the my tongue is my tongue campaigning to destigmatize TB. There's the word, and then also playing a great role in the awareness, raising awareness about TB in the communities, in the facilities, in all the areas where they are working. Please go check out the page. Destigmatize. Okay. The second step is to prevent new infections. We mentioned it earlier, but now I think they're going to give more. Oh, I was the one that was like running with the keywords. So sorry. So it's more or less the same things that I'm going to say. The second step is to prevent new TB infections. Let me just check the time. Oh, almost an hour. The second step is to prevent new TB infections. We aim to do this by increasing the uptake of tuberculosis preventative treatment, the TPT that I was talking about, at the healthcare facilities. This will be done by expanding the chronic medical conditions to include TB treatment and TPT. For those that are joining clubs at the health facilities, clubs like your chronic clubs, hypertension clients, diabetes clients, clients that has to collect the medication monthly and have their doctors check, and that club. So they're thinking of treating that the same way, where they do like distributing TPT the same way, TB preventive therapy. Remember, the person that is on TPT, TB preventive therapy, preventive, meaning I was a close contact of someone that has the TB disease. Oh, my battery is getting low. I was a close contact. I inhale the germ, the TB germ. I go to the clinic, I test for TB. My results come back negative. I don't have TB, but I'm infected with TB, meaning I have the TB germ in my body. I then take the TB preventative therapy or treatment to stop or to prevent this TB germ or bacilli to progress to active TB, to TB disease. That is now when the person is sick with TB. So to prevent that process, this person that was exposed is taking the TB preventive. The name itself is saying it, you prevent this person from getting TB. So they're taking this medication to prevent the TB germ to progress to active TB. But I don't want to confuse you. We will make a separate video. Now I'm going to run through the last part because the battery is almost flat. Implementing new TB regime, TPT. So when I say TPT, remember we're talking about prevention. It's medication that you take to prevent TB, active TB. I'm looking at the time. Implementing new TPT regime, including 3HP. We will explain to you that in the next video. And 3RH treatments. That means it's a shorter TPT regime. It's shorter than the 6 months. We will get there. That is part of the keeping people to take their treatment and complete their treatment. Instead of 6 months, you can take it for 3 months. But there's a whole new video for that one. Yeah. The video will come after this one. Conducting joint screening and TB and COVID-19 testing for COVID-19 and TB according to the revised guidelines. Important to read our guidelines. Implementing of TB screening app that will be... sorry. Sorry, I'm almost done. Shame this poor phone is tired of me. That is why it just wants to fall. I wanted to say something. Yeah, screening app. There is an app. I will type on or give you a screenshot as to that. You can do that on your phone. You can do that on your phone to screen yourself. Questions that they're asking, yes or no, yes or no. At the end, they can tell you, do you need to go to the clinic or what? So that is available on your phone. Using the community health workers program, that you see the community health workers in our communities program to increase the testing for TB among all TB. So community health workers at the moment that's testing for TB, they are being called community health workers, targeted universal TB testing. As I said, I'm rushing now. I will do a separate video with all these terms that I'm using, but I would like you to know what is happening in the community so that you can know that there's resources. You don't sometimes have to go to the clinic. You can go to the NPO in that community that is dealing also with the TB program. What was it now? Conducting, revise, implementing, using the community health workers program to increase testing for TB among all TB contexts and high-risk populations. We talked about the TB context now. Improving and maintaining infection prevention and control at the healthcare facilities and other places of congregation. Increasing TB testing at shelters shelters used to house homeless people during national emergencies, and maintaining BCG vaccination. BCG is the vaccination that the children, babies get to cover them against TB. We talked about homeless people. We talked about, your environment that can also contribute to this fuel. Again, that is where your community health workers comes in the communities, because they will be able to reach out to these like shelters, all the and to churches, and all places, to do screenings and taking sputums and teach people about infection prevention and control. Our third step is ensuring the rapid diagnosis. Oh, let me see how many pages. It's actually one page, but it seems like I'm not getting through to the. Our third step is ensuring the rapid diagnosis of TB early. As said, we mentioned that initiating treatment and adhere up to the treatment you have to complete. Technology will play a key role in implementing this step, because now when someone starts on treatment, it needs to be recorded somewhere for you to be able to follow if the person completed so that is where the data management will come in to follow that process. I'm not going to read everything, but that's what that means. Use SMS to inform patient whether they tested negatively is already happening from the lab. National Health Laboratory system. Yeah. They will send a SMS to your phone to say what was the result of your test that you sent, your sample that you sent. So make sure that when they do fill out that form that goes to the lab, that your phone number is correctly. So they, as soon as the lab test, you can already get that SMS after they're done. Yeah, you get that first. If it's negative, your test will say it's negative, that SMS. If it's positive, it won't say your test is positive, because they don't know who's on the other side of that phone. They will say, visit the clinic immediately. Go and see the healthcare worker at the clinic. Something in that line. Technology, SMS. We will strengthen our hospital management and information systems. Again, that's all the technological stuff, and enable linkage to care when patients are referred to hospital, from the hospital to the clinic. So they will strengthen that. Okay, if needed, technology will also play a role, as we will pilot and progressively expand the use of mobile digital x-rays. We will implement the urine lamp testing in facilities, which is recommended for those with advanced HIV disease or people living with HIV with possible TB. So that is just a test that is done with a urine sample, a TB test. So it's not everyone that gets that test. I will explain that one in the next video. And this will be supported through targeted universal TB testing for high-risk groups. So targeted universal TB testing is the TUT. If you hear that word TUT, you can ask the community health workers, what is TUT? But we also teach them not to use this abbreviation when they communicate with the community. When they go to household visits, they must give the full word and then also explain what does it mean, so that the community understand. Yeah. So our fourth step, that is the last step, is to mobilize a whole government and a whole society response to tackle TB. We will mobilize all civil society organizations. Now that is where all of us now gets involved. Mobilize all civil society organizations to take the lead in our campaign to mobilize citizens and communities in our collective fight against TB. Establish a multi-sectoral team to define specific contributions to other government departments. Through these steps, we aim to not only meet but hopefully exceed global and local commitments to end TB by 2035. As I have outlined, a person's socio-economic circumstances play a huge role in their susceptibility to getting TB. As I've outlined, so let us weer outline. A person's socio-economic circumstances play a huge role in their susceptibility to getting TB. Remember, anyone can get TB, rich or poor, anyone, old or young, can get TB. But listen to this sentence. A person's socio-economic circumstances. Remember, okay, let me leave that for another session or video, because then we will talk about what's the difference between rich and poor when you look at resources, and why is this group vulnerable. Why is this group more at risk? Those are the things we can look at because it's huge. But I want to outline that last sentence before my phone goes off. Was ek nou? A person's socio-economic circumstances play a huge role in their susceptibility to getting TB. For this reason, another equally important leg. Sorry, I'm so rushing now. Nou praat ek sommer my eie goed, my eie Engels. For this reason, another equally important leg of our plan is to conduct enhanced advocacy for socio-economic improvement, including psychosocial and nutritional support interventions for those living with TB. These efforts will be brought together through the establishment and launch of a provincial TB caucus housed in the Western Cape Provincial Parliament. While our response plan will go a long way, I call on residents, NGOs, NPOs, faith-based organizations, churches, mosques, civil society, and those in the private sectors to join us in the fight against TB. I speak for myself and for the entire, I think this is I will get to the title now, Premier. I think that's him that's saying I here at the bottom. I speak for myself, I think that's him. I speak for myself and for the entire PCAT group when I say that TB is our next big fight and we are committed to fighting it head on. Speaking line, sorry. That is why I'm saying I mustn't mix that plus that, because I wanted to say this fight and it should have been a big fight forever. It's not a new fight to be a big fight. It's yeah. Anyway, that's me. Let's scrap that off the video. And we are committed to fighting it head on. If we stand together now, we can defeat TB in the Western Cape and help achieve the well-being and dignity, yes, that every single person in our province deserves. That is why I'm saying this is a Western Cape document. I'm just now coming in with my things now. When we look at the South Africa as a whole, all your provinces, because we're fighting it on the one side, and then there's immigration daily. Immigration, people coming in and going out again. It's not that they're going to stay, maybe they have TB, complete TB, or even while they're busy taking TB medication, they have to go again. So let's look at it as a whole life of in South Africa. All the provinces and all the communities have to do the same thing, the same fight, to make sure if I'm in this province, I fight TB. If I now migrating to Western Cape, I must know who to link with. I must continue with my treatment here. Because in my mind, every person already needs to know how important it is to fight TB and the spread of TB. And if I have TB, if I have to move around, I must take responsibility for myself and also think of the people around me. So if I move from one province to province, then this fight is going to be futile. Is that the right word? I'm now making my own things now. My own words. Not my own things, my own words. Ja, dan sal dit mos nou, het gaan nie werk as dit nie gebeur op ander plekke nie en die migration van die elke dag plaas en net een werk aan. Maar soos ek vroeger, what I said earlier, all the provinces are working equally hard to combat TB. But I think the main thing is to get to the community. We have to get to on grassroots levels where it's all happening. The awareness, making sure that everyone gets on treatment that is positive, and then help and support that they stay on treatment until the duration of the treatment, and make sure that everyone that was exposed can start on TPT immediately for them not to fall ill later with TB. So that was a 2-page document. So now after this one, I just want you to get the background. This was launched in 2021. So now there is the policy, the implementation phase that started, that was implemented. Implementing is starting something. So yeah, we've started, and I will play a video, first the video, and then in that video you will identify with some of the stuff that was said on this document. So goodbye everyone. Please do listen to the full video, and the next video will follow. You will understand the next video once you finish watching this one. Bye-bye.